We've been hearing it like you have over the years about how important it is to floss. It's the most important thing in your mouth is this little thread between your teeth. Guess what? Information came out yesterday that says there's little to no evidence that backs up that information. Dr. Smiley has been propagating this information with his patients for years. Smiley Family Dentistry. Doc,
you are not going to throw him under the bus like that. Come on.
I'm looking for someone to say it's okay not to floss anymore. But I guess state your case, Doc. Why did they say there's little to no evidence if you guys have said it's so important?
Well, if we take a look at evidence-based health care, the whole idea of the level of evidence relates to studies. Now, the federal government, when it comes to making regulations, or recommendations, I should say, they're talking about a standard of evidence before they come out and promote something. Now, flossing first appeared, I think, back in 1979 in the Surgeon General's report as a recommendation, and it's been part of the FDA's recommendations since then when it comes to maintaining health to do daily flossing. And what they basically were able to show from the Associated Press was the level of evidence that's out there is very weak as far as whether or not flossing is actually effective. Now, we have to take a look at what that means. When we take a look at studies that are out there for flossing, they're usually short-term duration. They're a few weeks, few months, maybe 6 months duration. And periodontal disease, gum disease, is something that's slow developing and it's progressive. So what you're going to see as far as impact in a short-term study may not be telling the whole story.
So what you're saying is that because a study says that their findings don't mean that this works, it is very possible that my dental expert, when I go in and see her in a few days, is going to say, I don't care what the study says. I've been doing this for 25 years and flossing works. I've got my own proof. I can verify it because I see it every day.
Well, I think that when we, again, look at evidence-based dentistry, we take a look at the clinician's expertise and expert opinion, too. And that's very valid. I think certainly I know in my practice that the patients who floss regularly spend less time in my chair.
Well, that's all I need to know.
Yeah, exactly.
No, I'm sure your chair is very comfortable, but
Do you have the personal TVs? No, I'm just kidding.
Doc, what would you say then to those who are a little more hard over on this evidence that say you're just a shill for big floss?
Well, I tell you what, we know, the Centers for Disease Control will tell us that 47% of all Americans age 30 and older have the signs of gum disease. And we know that when they hit age 65, that jumps to 70% of adults have gum disease or periodontal disease. So we know it's slow, it's progressive, it gets worse over time. And I think anybody who's resistant to that, you've got to recognize that brushing alone still doesn't do the whole story. It's not uncommon to hear people say, gee, I brush my teeth, and if I go back and floss afterwards, I get all these nasty tastes out of there. Well, what that is that's the really aggressive, nasty bacteria in between teeth that flossing or that brushing alone can't remove. And those are the kinds of bacteria that end up causing tissue breakdown, gum disease, attachment loss, and things like that. We all can agree that, the stuff that's caught in between our teeth, food debris and so forth, smells nasty and tastes bad. But, if we don't get it out of there, it's going to lead to perhaps the development of cavities and gum disease. So I still recommend the use of floss. We know it's low risk, it's low cost. There is evidence that shows it may have an effect. It's not strong evidence, it's weak evidence. But it may have an effect. And the cost is low, the risk is low. Go ahead and do it.
There you go. That is Dr. Chris Smiley, Smiley Family Dentistry. As always, a pleasure. Thanks, Doc.
Hey, thanks to help you out.